Hewn from the finest English oak, it's the Medicare for the Lazy Man podcast. A podcast that wishes it had a twin podcast to play with. He once tried to defeat a brick wall in a game of tennis. Medicare expert Doug Jones.
Hello again, fellow Americans. It's such a pleasure to be here with you. This is another thrill-packed episode of the Medicare for the Lazy Man podcast. What are we doing here? Well, we're trying to help you feel really confident about your impending encounter with Medicare. I don't know when that's going to happen for you, but whenever it happens, there are a couple of ways that you can be prepared for that encounter, and you can come through that encounter victorious. One of the ways that I suggest is that you go to Amazon.com and or BarnesandNoble.com and seek out my book, Medicare for the Lazy Man 2024. Now, it's about to be replaced by the 2025 edition, but whichever one you wind up with, you're going to find yourself holding a tool that will help you conquer Medicare. Your confusion will be relieved, your questions will be answered, and your path will be shown to be the easy and straight path through from Obamacare coverage to Medicare coverage, and you will be happy that you followed my directions. Now, my contact information is in the book, my email address particularly, and my website address. I've got a brand spanking new website that's all squeaky clean and just ready for you to show up and click on a couple of things. And one of the things you can click on would be a questionnaire, a very short questionnaire. There's a yellow button that says, send me a quote. So I can then predict how much you would have to pay for the excellent coverage that I recommend in your neck of the woods. All you have to do is answer a few questions like, where are you? Do you have a spouse living with you? If so, how old is that spouse? Just questions like that. What's your date of birth? What's your zip code? What's your county? So many people look at the question where it says name, address, city, state, county, and zip code, and they think it says country. They put in USA, or they think, I already know what country they're likely to be in, and they ignore it. I'm looking for the county because some of the Medicare supplements are rated by the county that you live in. So whenever you see a question on a questionnaire that I'm connected with, answer the question. Don't just shine it on, because I need that information in order to do the best job possible for you. Anyway, when you have the book, you'll bring it home, you'll sit down with it, you'll spend probably an hour to an hour and a half going through it, and you'll have a couple of chuckles, and you will be well equipped to handle Medicare when Medicare time arrives for you. So that's my recommendation, and I'm hoping that you will contact me, because I am a licensed agent everywhere in the United States. And when it comes time for you to enroll in Medicare and to acquire your Medicare supplement and your drug plan, I'm the guy to help you out, and I'll be happy to do that for you. All righty. Speaking of being happy, there's a very happy Randy Carson sitting across the screen from me. He was a little down in the dumps earlier today, but I think we have fixed that and had an attitude adjustment that has worked for Randy. So I want to say good morning to him now. Good morning, Randy.
Good morning, Doug. How the heck are you?
Well, I think I'm pretty good. I mean, the sun is shining. The pest control person has just scattered poison all over my property. I couldn't be happier every month when that happens. She's a little dynamo. She goes running around and she spreads about 3 or 4 different kinds of poison to kill every living thing that's out here. And that's the way I like it, because Arizona's got a lot of creepy crawlies that I'm frankly not real happy with. I never cared about them when I was a kid, never even saw them. I mean, I swear, I never saw a scorpion until I moved to Cave Creek, Arizona, which turns out to be Scorpion City, or at least it was until I got the pest control people. So that's
Well,
the short story about my happiness today.
you know something? I'm interested you say that because I have often described when people, friends and relatives, they ask me what it's like in living in Arizona, and I have always described it as us against the critters.
Well, I never felt that way when I lived in Tucson, never saw Critter 1. All the time when I was a kid, I spent climbing Camelback Mountain. I climbed both the back, the highest part of it, and I climbed the head. I never saw one critter. I, used to spend a lot of time as a little kid rolling around in the desert, and it was only after I moved into Cave Creek, Arizona, and not even right away. It didn't happen right away. It happened after the house had been here for a while.
Well, there's that plus, and we'll move on to some more exciting stuff here shortly. But the other favorite expression that I've heard out here is, "Do you have termites?" Well, if you don't now, wait 5 minutes.
Well, here's the deal. I've got a house on one side of me that had termites right after it was built, shortly after it was built. I've got a house on the other side of me that after 19 years had termites. My house has never had termites. And my termite guy, I've known for probably 18 years. And I said, "What's the deal here? When should I expect my termites?" And he said, "It's a pretty weird thing in this business, but there are some houses that just never get them." Now, you don't expect to hear that in Arizona. You got two kinds of houses: the house that has termites and the house that's about to have termites or that's going to have
Yes,
termites.
yes.
But for some reason, he said there's a small number of houses that just never get them. And 20 years now, I have never had termites.
Well, let's not talk about it anymore then, because
Yeah,
I don't want to jinx you.
I don't want to jinx it either. Also, in Arizona, we don't tent houses. My daughter's house in California has been tented, I think, at least twice. They've been out there for probably 20 years, maybe not 20, but quite some time. And they've had to have their house tented two different times because of termites. Why don't we use that technique in Arizona?
I don't know. I didn't know they did it for termites, but I have heard them using that technique for maybe not tent the entire house, but for bed bugs.
Mm,
That's the only way they can get rid of them, get rid of bed bugs too.
really? Wow. Well,
So
I've stayed in a million hotels. I've had people who I think are maybe a little nutty tell me that bed bugs are a valid concern. I've never had bed bug one, and I hope never to, but it's just never been a thing that I've ever encountered, even though people
now
talk about them all
now
the
they're
time.
out there waiting for you.
Yeah, well, them and the termites are, I can see them. I can see them
No,
high-fiving each other. We'll get
there,
him
there,
when he.
there's some sort of a plan going on out in your front yard. I can
Sure.
see it.
Yeah, this
So
is why.
anyway, here we go.
All right.
I'm going to do my. It's one of my responsibilities, as you
Is this
know.
your Medicare Advantage minute duty?
It is. It
All right.
is.
All righty. Uh,
So, those of you who haven't heard, it's my job to pick out an article that Doug will discuss about Medicare Advantage and all the 15,000 reasons you don't want to go within 14 miles of one.
right.
Did I make that clear enough?
That was perfectly stated. I wish I had thought of doing that or saying it that way myself. Much more
Okay,
clear and concise.
we're going to go on this particular day. We're going to go with lucky number, lucky letter, lucky whatever you want to call it. Be like Bob.
Oh my God, I hadn't anticipated that. You're always throwing curveballs at me, Randy. All right, I've crossed it out so we won't ever accidentally address this article again. Then I got to dig into the pile and find letter B, that I can see by the yellow highlighting that the content curator has had her way with this article. I might have heard her giggling about it the other day. So here we go. Headline of the Medicare Advantage Minute article is Medicare Advantage prior authorization rates keep climbing. Here are 10 things that you need to know. So the number of Medicare prior authorization, excuse me, the number, I got so excited I can't even, I'm reading so far ahead of my eyeballs. My brain has not had time to catch up. The number of prior authorization
You know what's
determined.
happened? You know what's happened, don't you?
What's that?
Not enough caffeine.
Well, I'm not a coffee drinker. I'm a hot tea drinker in the morning. And
Well, that's got more caffeine in it than coffee.
well, then you'd think I'd be in in shape to address this wonderful article, wouldn't you? But no, I've got to slow down and be a little more careful. So, the number of prior authorization determinations issued by Medicare Advantage insurers continued to grow in 2023, according to a new report. Now, this article was written at the end of January 2025, so it took them that long to crunch the numbers. The growing number of Medicare Advantage beneficiaries, meaning participants, that means growing prior authorization requests, according to KFF, which used to be the Kaiser Family Foundation. I think the Kaiser Family Foundation said, hey, you're too lefty for us. We're going to spin you off and you can just do your own thing. So they had to change their name to KFF, and they protest that they are not related to the Kaiser Family Foundation anymore. But what they do is they collect information about Medicare stuff. So anyway, the number of prior authorization determinations has increased. They put have, H-A-V-E. In reality, the word should be has increased each year since 2021. The number of requests per participant was largely unchanged from 2022 to 2023. In 2022, insurers approved 1.7 prior authorization requests per participant. Here are 10 other things to know. Number one, Medicare Advantage insurers denied 3.2 million prior authorization requests in 1 year, 2023. 3.2 million prior authorization requests were denied. That was 6.4% of all requests. Number two, the percentage of denied prior authorization requests declined from 2022, when Medicare Advantage insurers denied 7.4% of requests that year. So we know what they would like to do. It's just that public pressure and maybe some regulatory pressure is stopping them from denying all requests or denying a larger percentage of requests. That's what they would really like to do. Because if they don't have to pay for your medical treatment, they make that much more money. And I don't have a problem with people making money, but it should be made honestly, not on the backs of people who are suffering and need medical treatment. Number three, the majority of denied prior authorization requests were not appealed. Now, we knew that. So out of all the prior authorization requests in 2023, only about 12% of the denied requests were appealed. So something like 88% of the requests were not appealed. Those people felt that an appeal was either too difficult to do, they didn't know that it was available to them, or they were maybe in a coma and not able to appeal their denial of treatment. Number five, in 2023, more than 4 out of 5, that's 80% of prior authorizations that were denied were eventually approved after an appeal. That means for those few people that actually filed an appeal, 80% of them were successful. So the plan denied a huge number of prior authorization requests for treatment. And then a small number of those denials were appealed. And of those appeals, 80% were approved by the plan. What does that tell you? The plan denies appeals just because it knows that many of the people will not even come back and ask for permission in a different way or through the appeals process. They just know that it's going to work. They know that if they throw enough poop against the wall, enough of it's going to stick that will improve their cash flow. Number six, the number of prior authorizations varied by insurer. Humana and Anthem had the highest rate of prior authorization determinations per participant at 3-1. Number seven, Kaiser Permanente had the lowest at 0.5 prior authorization determinations per participant. Number eight, the number of prior authorization denials also varied by insurer. Centene had the highest rate of denials at 13.6% of all requests. Humana had the lowest at 3.5%. Prior authorization, this is 9, prior authorization is used for a small share of traditional Medicare services and has increased over the past 3 years. In 2023, the government completed almost 400,000 prior authorization reviews, up from around 260,000 a year earlier. In 2023, the government denied almost 29% of prior authorization requests in traditional Medicare. Now that's traditional Medicare. Traditional Medicare almost has no prior authorizations. Almost everything is going to be covered or denied based on the doctor's determination of medical necessity. So it's very rare that there is a prior authorization problem with Medicare, traditional Medicare. So CMS, the government, allowed 28.8%, almost 29% of prior authorization requests in traditional Medicare to be denied. I never hear about prior authorization requests being denied by the government or by anybody else. And so I believe that that represents a very small proportion of all the possible prior authorization requests that people in regular Medicare had. I think we should move right along to Your Medicare Benefits 2024. This is a book that the government puts out that lists almost everything that Medicare can do for you, and it tells how a lot of this stuff would be covered. What we're going to address today is cosmetic surgery. Cosmetic surgery is typically a voluntary, what would you call it? A procedure that mostly is something that is not medically necessary. It's cosmetic in nature often. However, if people have certain types of medical problems where surgery has caused a difficulty, then cosmetic surgery can be covered by Medicare to repair you, to put you back the way you were, hopefully, before the treatment occurred. So let's see what it has to say about cosmetic surgery. Medicare usually does not cover cosmetic surgery unless you need it because of an accidental injury or to improve the function of a malformed body part. Medicare covers breast reconstruction if you had a mastectomy because of breast cancer, and that's addressed elsewhere in the book. For typically for cosmetic surgery, you would pay 100% for non-covered services, and that includes most cosmetic surgery. Medicare requires prior authorization. We just talked about prior authorization, so this might be where people are asking for permission to have Medicare pay for some of their cosmetic surgery, and maybe Medicare is turning them down because it's, frankly, not medically necessary. But let's read on and find out. Medicare requires prior authorization before you get these hospital outpatient services that are sometimes, but not always, considered cosmetic. One is a blepharoplasty. I'm going to spell this. It's B as in Bravo, Lepharo plasty. That's surgery on your eyelid to remove droopy, fatty, or excess tissue. Wow, that's a new one on me. Randy's eyes are getting a little heavy right now. He seems to be drifting off, but I'm guessing that Medicare would fix that if we ever actually got him to a Medicare licensed participant. Here's another word I've never heard before: botulinum. Botulln. No, IN. Let's start again. Botulinum. Oh, it's like Botox. Botulinum toxin injections. These are injections used to treat muscle disorders like spasms and twitches. Randy's twitching right now. He's very susceptible to, oh boy. All right. Hang on, Randy. Hang on to the desk. Here's another word I've never heard before: panniculectomy. This is surgery to remove excess skin and tissue from your lower abdomen. I'm guessing that's after a successful diet. Rhinoplasty or nose job, surgery to change the shape of your nose. And vein ablation, surgery to Randy's honking at me. I heard something about scientists having figured out how to genetically create a woolly mammoth. And what Randy was just doing looked like a woolly mammoth nose that needed some rhinoplasty. So It was ironic that that would happen on the same day I heard about scientists creating woolly mammoths. The final category here is vein ablation surgery to close off veins. If your procedure requires prior authorization before Medicare will pay for it, you don't need to do anything. Your doctor, your provider, will send a prior authorization request and documentation to Medicare for approval before performing the procedure. If Medicare approves your prior authorization request, you should only need to pay your deductible and coinsurance. And you don't even need to pay that if you've got a Medicare supplement, or you might need to pay a little bit of it just because you've got the kind of Medicare supplement that I recommend, which is Medicare high deductible Plan G. For more information, go to medicare.gov/coverage/cosmetic surgery. So pretty cool. I believe now it's time for a surgery of a different nature, wherein our sponsors attempt to separate you from your money. So let's find out how successful they're going to be. All righty. We're back, and we are hoping that you still have some of your cash left, because I know that we're not going to hire any sort of run-of-the-mill doofus for a sponsor. Our sponsors are going to be skillful at separating you from your money and sending some of it to us for our Christmas party. We put it in a big piggy bank every week, and eventually we're going to be going to an expensive restaurant and just, blowing on noisemakers and splashing our mugs of Guinness and just having a good old time like we did.
Are we going to upscale from Burger King this year?
No, I'm afraid we're not going to be able to
Oh,
afford to do that, Randy.
oh, darn it.
The best we can hope for would be In-N-Out, which is something people in
In
the
it,
East
well, yeah, In-N-Out's pretty good, but I do like Burger King. I don't know. Do you like Burger King?
I never liked Burger King. I was always a McDonald's guy.
Oh, well, they're good too. The reason I like Burger King is because back when I was poor college student,
Yes.
you got lots to eat for not a lot of money, but that's not true anymore. A Whopper today, you got to take out a frickin' installment loan for.
Well, you know something? I guess I'm not a big chow hound, because a lot of people would eat Big Macs and with the equivalent, I'm guessing, of the Whopper. And I was never a Big Mac guy. Just give me a regular hamburger for what used to be 12 cents. I don't know what they're charging for them
Oh
now.
yeah, you are going to be terrifically shocked that they're not 12 cents anymore,
Oh,
man.
darn it. Well, that's disappointing. But I will tell you that my family was involved in the creation of McDonald's, or the franchise effort of McDonald's. We helped to fund it back in the 1950s. An agent of ours that worked for the John Hancock and my family was a friend or an acquaintance of Ray Kroc, and Ray Kroc became this guy's client. And one of Ray's ideas and goals was to franchise his hamburger thing that he bought from the McDonald's brothers. And so where did he get the funding for it? From the John Hancock, which was sitting on huge piles of cash. And they said, hey, we will invest in your idea. And it turned out to be a pretty good investment.
Go figure.
Yeah. Randy's licking his lips like, oh boy.
And now I'm
that's
hungry.
yeah.
Doggone it.
Well, I'm proud to have been involved in that very successful enterprise. And when I was in college, I ate my share of McDonald's hamburgers, and they were pretty darn tasty. I thoroughly enjoyed every one.
They still are. They still are. And in terms of the fries,
Uh-huh.
I still think McDonald's fries are much better than other people's
They're
fries.
like magic. They're like
Yes.
magic. They're good either with or without ketchup. I like them with ketchup, but if I'm driving, I'll eat them right out of the container without ketchup, because I
Oh
don't
yeah.
want to kill myself. And it's still a very, very tasty treat. Um, I will say that their milkshakes used to suck. I don't know if they still do, but I never liked them. I go to all the way across town to Dairy Queen or Tasty Freeze to get a regular milkshake.
Well, back in the Midwest, those are people from the Midwest will remember, at least in Omaha, they'll remember probably the top of the heap back there was a place called Goodrich, and
Okay.
you could get a milkshake or a malt at Goodrich that was just it was like going to heaven and coming back.
But that would be a local place, right? Not a
Yeah,
franchise.
yeah,
Yeah.
it was a local place. So I was guessing that you might want to go ahead and finish up here. We'll quit jaw jacking here, but bottom line is I do have one more thing to mention to you.
Uh-oh.
As part of my job, I always
Yeah.
have to come up with memorable names for
Uh-huh.
various things that we discussed, and I came
Right.
up with a new one today.
Oh boy, what are you going to call me?
No, not you.
Oh, okay.
I
Lay
I
it on me
came
then.
I came up with a new one called Metacrooks.
Oh, good. That's a nice one. I like that. It doesn't need any explanation, but I know exactly
No,
what you're.
no. Everybody will know exactly what Metacrux means. So, I thought
Yes.
I would lay that out there, and if anybody wants to start ordering T-shirts, that would be a good one to start with.
I'm glad you did. Well, here's correspondence that I finished up this morning. Well, I don't know if it's finished or not because I haven't gotten a response yet, but started yesterday. I got an email from a gentleman who has been corresponding with me about his Medicare choices. So his name is Bill and his wife's name is Susan. And he starts out, Doug, I have read your book and I've reached out to you in the past with some questions. I am nearing the point where we have to decide a path forward for my wife, and I wanted to sanity check it with you because it goes against your advice in the book. Now, why would I read this if it goes against my advice? Well, you'll see in just a few moments. He says, my wife has already started collecting Social Security and will turn 65 in June of 2025, just a couple of months from now. Her plan is to get on Medicare starting June 1st of 2025. So here is what we are thinking. Step one, we understand that she will have to pay the $185 Part B. He calls it, he'll have it deducted from her Social Security check. Number two, we are in New York State. So as we understand things, we can sign up for a Medicare Advantage plan and switch to a Medigap supplement plan if we want to, if she wants to, without any penalty starting in January open enrollment period. Number three, the way I understand it, a triggering event would be if she needed something like infusions, radiation, dialysis. Number four, Medicare Advantage plan we are leaning toward is Excellus, Blue Cross Blue Shield, PPO, Medicare Blue Choice Discovery. See attachments for a few pages of the plan highlights, like I'm going to do homework on a Medicare Advantage plan. The monthly premium is just $34.30 for this Medicare Advantage plan. Well, a lot of them are free. So that's, I suppose in New York, though, that's probably not a consequential monthly amount. Number five, that's the monthly premium he told me about. Number six, this would also cover preventive dental, eyewear allowance prescriptions, and gym membership. Oh, and he threw in hearing as well. All right, so that's not really a deep dental plan. It's preventive dental only. And it sounds like examinations only for hearing and vision. This sounds like a much more affordable option than signing up for a high deductible Part G plan. The monthly premium for something like Globe Life, which is the plan I would have enrolled him with, is about $60 a month. But then my wife would have to get separate dental, vision, and gym membership. We belong to the YMCA. Bill says, let me stop there and see what you think and what I may be overlooking. Thank you very much. So I responded to Bill. I said, I don't need to look at the benefit descriptions. All I need to hear is that you and you and the missus have thought this plan through. If the financial savings you have outlined are enough motivation to arrange things this way, who am I to object? I have helped some desperate people move from Medicare Advantage plans back to Medicare plus Medicare supplements, and they have been grateful. I hope your wife does not wind up in the same kind of situation. The element that makes it work is the fact that you are in New York, which allows one to acquire a Medicare supplement any time of the year without having to answer any medical questions. No need for any kind of trigger either. The only thing is to watch the calendar. The limiting factor is being able to disenroll from the Medicare Advantage plan and automatically return to original Medicare, which can only happen from January 1st to March 31st. Let me know whenever I can be of further help. And then this morning I found this. Thanks for your quick response. This is from Bill again. The fact is, we are still thinking it through and value your perspective. I have recommended your book to several friends and family members, and they have all found it helpful. Honestly, I was a little confused by your response. This is still Bill talking here. It sounds like because we are in New York, we would be able to switch to Medicare supplement anytime during the year without having to answer any medical questions. But then you said the limiting factor is being able to disenroll from a Medicare Advantage plan and automatically return to original Medicare, which can only happen from January 1st to March 31st. So which is it? You also said, I have helped some desperate people move from Medicare Advantage plans back to Medicare Plus supplements, and they have been grateful. I hope your wife does not wind up in the same kind of situation. This is very ominous. How would that happen? Would that be if we ever decided to leave New York? We do not have plans on leaving New York, but if we ever did, couldn't we just switch to a supplement before we left? Finally, are there any financial penalties for switching from an Advantage plan to a Medicare supplement, even in New York? Let me know. So I had to respond to those questions, and I thought maybe it would be suitable for this podcast episode. So this is my answer this morning, and I did it like minutes before I contacted Randy to begin our recording session. I said, I'm not trying to frighten you, but it is a fact that if anyone wants to enroll in a Medicare Advantage plan, they must have enrolled in Part A and B either first or at the same time as they want the Medicare Advantage plan to start. If they later want to avail themselves of the freedom of choice and lack of restriction that original Medicare offers, they must disenroll from that Medicare Advantage plan first, which automatically returns them to Medicare. After that, they had better be able to obtain a Medicare supplement, or they will be exposed to a great deal of cost sharing for expenses that Medicare only partially covers, like 80% instead of 100%. To answer your questions, it is illegal to sell a person a supplement unless the existing Medicare Advantage plan will be terminated. Written evidence of that termination is usually required to be submitted with the Medicare supplement application. If you were to leave New York, most other states, not all, but most other states, allow the insurance company to require evidence of good health via a medical history questionnaire before issuing a supplement to someone. Only a few states make it as simple as New York. I cannot think of any financial penalties for making the change. The supplement plans charge more for their protection, but their cost-sharing requirements are generally much less for those who need substantial medical treatment. The procedure is able to be executed during AEP, otherwise known as open enrollment, in the fall, and that coverage would be effective January 1st. Or it can be executed in the first 3 months for coverage to be effective either February 1st, March 1st, or April 1st. After that, one cannot disenroll from their existing Medicare Advantage plan until the following AEP next fall, which means the new coverage would be effective the first of the following year. Fresh in my mind, just this year, are the following requests. A couple in New York who found themselves trapped in a Medicare Advantage plan from the same company that your wife is considering when the wife had a horrible medical problem arise and the plan dragged its feet when approving the needed medical treatment. They were very happy when I arranged for them to return to Medicare and obtain Medicare supplements. In Illinois, a son asked me to perform the same service for his mother, who was forced to endure a wholly unsatisfactory post-op rehabilitation facility by Blue Cross Blue Shield of Illinois, a highly respected insurance company. The same thing happened to one of my wife's childhood friends. In Illinois, I was able to take advantage of unusual circumstances to get these people into Medicare supplement plans with which they are very pleased. A woman in Texas was not so fortunate. Her highly respected Medicare Advantage plan would not pay for a specialist to repair a botched knee replacement. Now, her highly respected Medicare Advantage plan, by the way, was Kaiser Permanente. A lot of people think that's the best of the best in the West. but it's not always working out that way. This woman had a botched knee replacement. Kaiser refused to pay for anybody but the Kaiser doctor who did the original knee replacement to work on it. No, I think they said we're not going to pay for anybody to do anything to her knee. She was not able to find a qualified surgeon that would perform the job without the proper insurance coverage in place. These types of problems may never happen to you and your family, Bill, and I hope they never do. However, my calling is to encourage my clients to exercise caution so they never get trapped with unworkable coverage. I hope this helps clarify my situation. I'm sure I'm going to hear from Bill again, and that was the extent of my my correspondence with him to date about his lovely wife and her Medicare Advantage, her wanting to enroll in a Medicare Advantage to save a few bucks. I think it's probably not a good idea, but what if she enrolled in a Medicare supplement plan and paid, a little bit more money, paid something for the dental, vision, and hearing benefits that they want to continue, and let's say paid for the health club instead of the YMCA that apparently is free with this other plan. And let's suppose that nothing bad ever happened to her. Well, you rolls your dice, you takes your chances. And I can only say that if you want to play it safe, get a Medicare supplement plan from the get-go. Don't restrict yourself by getting a Medicare Advantage plan. Randy, I think it's time for us to consider closing the doors on this subject. What do you think?
Are you familiar with the term skedaddle?
Yeah, I am, but I'd like to hear your definition.
That means we need to close up shop, land the plane, put our table up, and come in on, we're going to come in on 36 right today.
Alrighty, let's do it.
That's our favorite, absolute favorite runway is 36 right. But before I do, there's three things, actually four, that I always want to take care of before we do that. If you want to reach out to Doug, write this email address down, dbj@mlmmailbag.com. Doug is licensed in all 50 states to help you, and I would certainly avail myself of his expertise. Check us out at the website, medicareforthelazyman.com. In your wanderings through the wilds of the internet, we would appreciate it if you could drop a review for us. It's early in the year, but we need to keep our eye on the prize because we always want to win our particular category. Last but certainly not least, thank you. Thank you personally for joining us. You could have been a number of different places, and you weren't. You were with us, which is exactly where we love to have you. But, there's one thing you guys never do, is you never check your watch. So I'm going to tell you, you have just spent about 32 and a half minutes with Doug Jones, the insurance guy, originally from Oklahoma. No more, he's living in the high ground behind Cave Creek, Arizona. And I like to call it the Nosebleed Mountains because it is so high. Doug is so high most of the time. I don't know.
Hey, wait a minute.
I'm gonna put him in. Oh, it's gonna be easy. 9,253 feet.
Been there, done that, got the t-shirt. Thank you for joining us, ladies and gentlemen. It's been a pleasure being your Medicare advisor for today, and I'm hoping that you'll come back for our next episode real soon. Bye-bye.